Hi friends, welcome back to the episode 3 of the final 15. This session is about environment and biomedical waste. So, if you are new here, let me tell you the final 15 is the 15-day daily quiz on my Telegram channel at the rate KSPSM. So, Telegram channel is at the rate KSPSM. You go to the Telegram and search at the rate KSPSM, right? So daily we are doing a topic, we are attempting quiz, and we are going through this video. Without any delay, let's get started. Now, coming to this question, a 45-year-old patient underwent surgery in a government hospital. Blood soaked cotton and gauze used during the procedure should be discarded in yellow. It should be discarded in yellow. So guys, this comes under the category of soiled waste. So soiled waste, human anatomical waste, discarded medicines, soiled waste, human anatomical waste, discarded medicine, and one more waste, that is microbiological and biotechnological waste. So here the correct answer is yellow. Coming to the next question, which of the following is not a step in rapid sand filter? Which of the following is not a step in rapid sand filter? Guys, in rapid sand filter, first step is precoagulation. In first step of precoagulation, we mix alum with the water. Then the water which is precoagulated, then the water is allowed to percolate from the filter. And here the cleaning is done by backwashing. In rapid sand filter, the cleaning is done by backwashing. And there is a layer, whitish layer, when there are some days of initiating the filter. After some days, there is a layer, and that layer is known as alum flock. Schmutz deck layer is not seen in rapid sand filter, it is seen in slow sand filter. All the other three options, they are seen in rapid sand filter. All these three options are seen in rapid sand filter. All of these options are seen in rapid sand filter. In Horrocks test, if fourth cup shows color change, then how much chlorine is needed for 455 liter of water? Guys, the formula is N into 2 gram is needed for 455 liter of water. What is N? N is the cup which shows color change. N is the cup which shows color change. In this scenario, N is 4 into 2 gram is for 455 liter. So 8 gram of chlorine is needed for 455 liter of water in this scenario. So here the correct answer is 8 gram. 8 gram chlorine is needed for 455 liter of water. Which of the following is the main advantage of slow sand filter? Removes all viruses? No. Removes iron? Removes? No. No need for skilled operator. In slow sand filter, there is no need for skilled operator. But in rapid sand filter, a skilled operator is needed. A skilled operator is needed in rapid sand filter. In slow sand filter, it is not needed. Also, I want to tell you, rapid sand filter, it occupies less space. Also, I want to talk about the cleaning. The cleaning of rapid sand filter is done by back washing. The cleaning is done by back washing, and there is a layer over the rapid sand filter. It is alum flock. It is alum flock. Now, which following test is used to test the adequacy of chlorination in water? It is orthotolidine test. The orthotolidine test, among all the options, orthotolidine test is done to check the residual chlorine in the water. Which of the following is not a waterborne disease? Waterborne disease is, it happens because of drinking contaminated water. Drinking contaminated water causes waterborne disease. Malaria is not a waterborne disease. Malaria is not a waterborne disease. All of these are, they happen because of consuming contaminated water. Most common cause of blue baby syndrome due to water contamination. So because of nitrate contamination of water, when the nitrate levels in the water, they are very high, it causes blue baby syndrome. It causes blue baby syndrome. It is because of nitrate. This is a simple one-liner question. Then, not a feature of deep well. Guys, please understand. This is the first impervious layer. This is the first impervious layer. Now, this first impervious layer, above this first impervious layer, there is some water. Below the first impervious layer, there is some water. Above first impervious layer, below first impervious layer, there is some water. And this layer is first impervious layer or impervious layer. Now, when you take water above the first, so when the well is taking the water above this level, it is shallow well. When the water is taking below this level, it is deep well. So when the water is going, when the water we are taking from a deep level, it will be hard water. Yes, it will be hard water. So deep well, this is a deep well. It will be much hard. Yes, much hard. Now it is so deep, the chances of contamination are less, so it is less contaminated. Number three, because it is deep, it will not be dry in case of summers, whereas shallow gets dry. So it gives a continuous 12-month supply. It gives a continuous supply, right? So water is from below first, this is true. Less contaminated, this is true. More hard, this is also true. Usually go dry in summers. This is not true. It does not go dry in summer because it is deep and there is no effect of summers on the deep water bodies. A family uses deep well water with fluoride content of 2.5 ppm. The most likely health effect. Guys, fluoride is a double-edged sword. That means if fluoride is less than 0.5 ppm, it will cause caries. If fluoride is more than 1.5 ppm, it will cause fluorosis. It will cause fluorosis, right? Now, if it is between 3 to 6 ppm, it will cause skeletal fluorosis. And if it is more than 10 ppm, it will cause crippling fluorosis. It will cause crippling fluorosis. So, till this point, we have dental fluorosis. So, the correct answer here will be dental fluorosis. Here, the correct answer will be dental fluorosis. Which of the following is correctly matched? Broken glass goes in red. No, it goes in blue. Expired medication and yellow bag. This is true. Expired medications, they go in yellow bag. Sharp metallic in blue bag, no, it goes in white. Body parts, it go in yellow. It go in yellow. So expired medications, they go in yellow bag. Also, I want to tell you, empty vial of any medication, it goes in blue. Empty vial of cytotoxic, it goes in yellow. It goes in yellow. Inertization is mainly used for which waste? Guys, what is inertization? We mix cement with waste. We mix cement with waste and we add some water, we add some alum, but basically just remember cement is mixed with waste. Now, have you heard about inert gases? What are inert gases? They don't react. So now this waste, when it is mixed with cement, it becomes inert. It is not going to harm. Usually for this purpose, pharmacological waste, expired medications, pharmacological waste can be used for the inertization, not the human anatomical waste, animal anatomical waste. Most preferred in this case is pharmaceutical waste. A nurse accidentally drops a tray with blood sample on floor. What is the first step? Guys, whenever this situation happens, mop up the area with water. Absolutely no. There is blood over there. We cannot do it. Inform the health authorities can be considered, but not the answer. Inform the health authorities. Cover the spill with 10% sodium hypochlorite. This is true. Cover spill with 10% sodium hypochlorite. Right? Now, this is true, but in this question, they have asked first step. So, this is not the first step. Cover spill with tissue paper. Cover spill with tissue paper. This is the first step. Always you soak the extra blood. If you don't have tissue paper, you use the newspaper. Then that newspaper, soaked tissue paper, newspaper should be discarded in yellow bin. After that, you should use sodium hypochlorite. After that, you should use sodium hypochlorite. If it is, now first is soak with tissue paper. Obviously, the nurse or the doctor or anyone there, they should wear a mask, gloves, PPE, they should wear proper, they should protect themselves, right? I'm not talking about hazmat suit from here. Hey, PPE doesn't mean hazmat suit here. PPE means personal protective, like they should wear a glove, they should wear a mask. First is soak the blood using tissue paper. Second, now use sodium hypochlorite. Sodium hypochlorite. If the blood is less than 10 ml, use 1 ml. If the blood spill is large, more than 10 ml blood, then you use 10%. Then you use 10%. Here 1% sodium hypochlorite. Here 10% sodium hypochlorite. Right? So this is the correct answer. Always soak the extra blood. The recommended disinfectant for cleaning a large blood spill is 10% sodium hypochlorite. 10% sodium hypochlorite. In case of mercury spill in a healthcare setting, which action is incorrect? Evacuate and ventilate the area? Yes. Many students were asking, sir, do we really ventilate the area? Yes, because the fumes will be concentrated in a room. Let the window open, let the fumes go, right? Rather than concentrating in one place. Wear gloves and mask? Definitely. Use vacuum cleaner to collect mercury? No. We do not use vacuum cleaner to collect the mercury. This is hazardous. Now what you do, rather for the mercury spill, what we do, take a syringe and suck all the mercury balls. See, mercury, when it comes with the in contact of air, because of the surface tension, it becomes the small beads, spherical beads. You have to just suck it in the syringe. Take a plastic bottle half filled with water, like the bottle which you have seen is used for the urine collection or the stool collection. Plastic bottle, small plastic bottle, fill it half with the water, place all the mercury over there, cover it, right, and hand it over to the person, to the facility who are expert in these managements, right? So this is what we do. We never vacuum, we never use broom to clean it, we never send all the mercury in the toilets. This should be avoided. This is the correct method, right? SI unit of source of light. So guys, this mnemonic, one student told me few years back. This is the source of light. What is the SI unit? What is the SI unit? Candela. Then the light flows. Then the light flows. And anything in medical, a tube-like structure is known as lumen. So for the flow of light, it is lumen. Now the light, it falls on surface and it glows like the soap. So light on surface is lux. Light on surface is lux. And now it will be re-emitted. This is known as Lambert. This is known as Lambert. Light re-emitting is Lambert. So source of light, the answer will be candela. The answer will be candela. Kata thermometer is used to measure cooling power. Kata thermometer is used to measure cooling power. This is alcohol based thermometer. According to India's national AQI, AQI value of 201 to 300 is classified as 0 to 500, 0 to 50, 0 to 50, 51 to 100, 101 to 200, 101 to 300, 301 to 400, and more than 400. This is severe. This is very poor. This is poor. This is poor. This is moderate. 51 to 100 is satisfactory. Satisfactory. And it is good. So in the question they have asked about 201 to 300. So the answer will be poor. The answer will be poor. Now, which of the following pollen is not included? So guys, a very easy thing I will be telling you here. To calculate AQI, two PMs are included. PM10, PM2.5. 2 PM are included. PM10, PM2.5. 3 are included. O3 and NH3. 3, right? O3, NH3. 2s are included. SO2 and NO2. Now, something is included where we don't have 2, 3. What is that? Carbon monoxide and PB. What is PB? PB is lead. PB is lead. So PM10 included. It is included. Ozone included. Yes. O3 is ozone. Sulfur dioxide, yes. Carbon dioxide is not included. Carbon dioxide is not included. Now, we are done with 15 questions. Now it is time for 15 one-liners. Cleaning in rapid sand filter is done by backwashing. And What about slow sand filter? How we clean slow sand filter? How we clean slow sand filter? It is done by scraping top layer. Scraping top layer. Major role of which compound in chlorination, guys? Whenever chlorine is added to water, we get HCl plus HOCl. HOCl is known as hypochlorous acid. This hypochlorous acid has major role. HOCl is further disintegrated in H plus plus OCl negative. This OCl negative has minor role, and this is hypochlorite ion. Hypochlorite ion. Major role hypochlorous acid. Minor role hypochlorite ion. AQI index we have already discussed. 2 pm. We have already discussed it, right? Now, guys, this is sling psychrometer. This is sling psychrometer. This is for humidity. This is Kata thermometer. This is Kata thermometer. Sanitary landfill method of waste disposal. Sanitary landfill method, it has three types: trench method, ramp method, area method. In trench method, there is a particular question: 1 acre land is needed in 1 year for 10,000 population. 1 acre land in 1 year for 10,000 population. Guys, this instrument is known as anemometer. This is anemometer, and this is for wind velocities. This is for wind velocity. Syringes discarded in red. Syringes discarded in red. Syringes discarded in red. I think this is repeat. Needles discarded in white. So, fixed needle syringes. Let me end this controversy. This is a matter of controversy since long. This is the needle. This is the syringe. This is the plunger. This is the hub. Right? So, the ideal thing is to cut it from the hub. This portion, metallic portion, goes in white, and the plastic portion goes in red. But if it is a fixed needle syringe, that means you have not detached, you have not removed it from the syringe. Needle is still there. Now, protecting, recycling a plastic waste is not that important for me, but protecting a person from the potential needle stick injury is more important for me. So that is why I will keep it in the white. Again, syringe red, needle white. Fixed needle syringe, it goes in white. Gloves, contaminated, non-contaminated. Blood stained, not blood stained. PVC, non-PVC. Used, unused. All goes in red. Blood bag, yellow. Urine bag, red. Empty vial of cytotoxic waste, yellow. And this logo is for biohazard. And this logo is for biohazard, right? So with this, I end this session. I hope the concepts are clear. Go through it, right? And the next episode is coming soon. The next episode is on health programs. Do watch it. Don't miss it. Thank you so much.